Good morning, Bob.
Good morning.
We'll start off today with a update from Dodge County Public Health Officer Abby Sauer. Good morning, Abby.
Good morning. So for an update this month or this today, we are definitely seeing cases go down finally. So for our case count, still on the higher side. We're averaging about 31 cases a day this last week, which is lower than what we were. We were hitting up into the 50s, so we're seeing now those numbers go down. Still urging people to take precautions and continue masking when unable to social distance or physical distancing. So those kind of things and all those measures that we've been stressing for months now, and most importantly, the vaccines. So getting vaccinated, and I have a big update for that. And probably people have seen that in the news. The booster dose for the Moderna and Johnson & Johnson and Pfizer a few weeks ago have all been approved through the FDA and all the way down to the CDC and Department of Health Services for Wisconsin has approved those as well. We are still waiting for some clinical guidance for the new ones, the Moderna and the Johnson & Johnson boosters. Some official guidance, which is supposed to be coming out any time now. So most likely today is what we're expecting that.
Now, for the boosters, is everyone eligible for the booster, or is there a certain criteria that have to be met?
Yeah.
How does that work?
Yeah, so for Johnson & Johnson, anyone 18 and older is eligible for that booster if they receive that. And eligibility is at the earliest 2 months after that first dose that they had.
Okay.
So anybody 18 and older for that one. For Pfizer and for Moderna, there is some criteria that individuals need to fall into in order to be eligible. For both of them, it's anybody 65 and older are eligible. For anybody who lives in a long-term care facility, they're eligible, 18 and older. Anyone 18 and older who have certain underlying medical conditions, which there's a list of them on our website and on the Department of Health Services websites, but it's anywhere from heart disease, lung issues such as asthma or COPD, diabetes, liver conditions. Anybody who's overweight or obese is eligible as well. So it's a pretty broad underlying condition list. And then one more is anybody 18 and older who works in high-risk settings. And those include corrections facilities, grocery stores, food service, manufacturing, places that people have to work in closer conditions and that they're higher risk of getting COVID-19. So.
Now, it sounds like nationally on the news there may be some developments for the younger ages, what is it, 6 and above?
Yep.
Is that correct?
It is, it's 5 and older, I believe.
5,
so.
okay.
And yes, and so they're having actually a meeting today on the 26th of October. They're having a meeting, the FDA is meeting to look at that. So there's still lots of steps that need to go through, a lot of approvals that need to happen. It's kind of it's a slow but steady process to get approval of the vaccine. But that is coming down the line. We do see that coming. Anybody that 5 to 11 age group for Pfizer is going to be most likely where what I'm hearing rumblings is probably by the second week of November there'll be approval for that, for the Pfizer.
Okay, then for that, my understanding that anyone who's in that age category would require parental authorization, correct?
Definitely.
Is there forms, or how do you handle that?
Yeah, so we have a parental form or a consent form that parents have to sign in order to give the vaccine, and that's just like with our 12 to 17-year-olds right now. We can't give that vaccine without the parent signing off and saying that they get consent to that vaccine.
Okay. What's the latest with the COVID test site in Beaver Dam that's still being supported by the National Guard and Emergency Management, correct?
That is correct. So we still have that test site every Wednesday from 11 to 5 p.m. And that test site is slotted to continue running until we don't need it anymore. We've also looked at, do we need to have more options for testing in Dodge County? So that's kind of something we're working on as well, is is the National Guard, if they can't continue their mission in Dodge County, how can we continue getting testing to individuals? So
At that test site?
At the same location, we'd like to continue, just because people know of the location, and it's been around for almost a year now, or I believe probably just about a year, that we've had that test site there, and we think it's a good location where a lot of people can get to.
And that's right at the corner of North Spring Street and I guess it's Corporate Drive or Industrial Drive.
Right.
The old Bassett Furniture.
That is correct. And there's plenty of parking. It is not a drive-through test site, but with winter coming again, we find that the best is that drive-through is can be a little bit cold and under, if the weather's not so good, where people do have to walk in, but there's plenty of room for physical distancing and spreading out and all those things.
And that's walk-in. I mean, anybody you don't need to call in advance, or is that recommended? You could just.
Nope, no appointment necessary. We don't take any appointments for it. It's just walk on in. People can pre-register, and that information is on our website. They can pre-register, which just makes that process a little bit easier, because then they get a QR code. They walk in, they scan the QR code, and they get tested, and they walk out. So it's a very easy process, especially when people pre-register.
Okay. And what's the latest status on your clinics? You've been offering some vaccination clinics, correct?
Yep, that is correct. So we are still offering all 3 vaccines. We offer Pfizer clinics every 3 weeks. Sometimes we pop in some extras here and there. We offer Johnson & Johnson frequently. We kind of did cut down on our clinics a little bit, just because we didn't have as much people needing our services. But we are bumping up our Moderna clinics a little bit, just with the booster coming out. So we do encourage people to look at our website, because we put them up there when we have them. But also with the vaccines, there's many options to get vaccinated other places. So.
And public health, you've been out at some of the schools, local schools, correct?
Yep, we've been doing flu vaccines at local schools.
Okay. How's that going?
So, very good. Sorry, I got a little tickle. Yep, we've been doing flu clinics in the schools, and that's been going very well.
Okay. There was also a flu clinic recently for Dodge County employees.
That is correct.
So I went in to have my flu shot. So I wanted to get that taken care of.
Yes, we definitely want people to get the flu shots as well.
And at times that seems to be overlooked now, where
right.
Prior to COVID it was pretty prominent this time of the year.
Mm-hmm, definitely.
And now I don't want to say it's an afterthought, and I know that you're trying to educate on that as well, to still have your flu shot.
Right, exactly. So flu is it can hit people pretty hard too, so we want people to get that flu shot as well, and you don't have to wait to get your COVID. You can get them both at the same time if able.
Okay. Dealing with the Johnson & Johnson vaccine,
Excuse me.
you said that 2 months after that first shot, they can get another shot. Does it have to be Johnson & Johnson?
Right. So now they have put out that you can get either one for a booster, so you don't have to stick with the one you originally got.
Okay. And what are your days and times for your clinics at Public Health?
So they do vary, because we are really in the midst of doing flu clinics right now. So I encourage people to check out our website, because it's going to be different every week. Like this week, we do have a Moderna and Pfizer, Johnson & Johnson, all 3 this Friday, where people can come in and get either any one of the 3 vaccines. But like next week, I believe we might have a Thursday and a Friday. So it's going to vary. Please check our website, and that'll tell you when our clinics are.
Do people need to get an appointment?
We really do encourage people to call to make an appointment, but they do not have to.
Okay, well, as you've indicated, there's certainly been a great deal of activity with Dodge County Public Health, and actually it seems a evolving process with the vaccinations and the boosters, and now maybe the younger children being eligible, and so
Yeah.
it's an ever-changing landscape.
For sure, for sure. Always changing. And I do want to know, because I don't think I mentioned it, for the Pfizer and the Moderna, it's 6 months after that second dose that people are eligible for that booster. So we can't give it any earlier than 6 months.
So with that being said, if someone comes in, do you verify those dates?
Yes,
with
we
them?
do. And that is why we prefer somebody to make an appointment, because then we can already check their vaccinations on through the Wisconsin Immunization Registry and ensure that they're not coming too early. If they just show up for a vaccine, then we do have to check that.
Okay.
Well, these people should be arriving with their card that was filled out the first 2 shots.
Yes, that's correct. We still do verify it on the registry. And yes, we do want people to bring their cards with them so we can put that third dose on there.
Okay. Great. Any questions from you, Bob? Didn't want to monopolize here, but just,
No, I think I asked the questions that came to mind.
okay. Well, it's great to have you, and thank you for making the time today, and thank you and your public health team for all that you do. Now we're approaching November, and it's hard to believe it's been a year and a half plus.
Right.
And so there's been a lot to deal with yourself and your team and all the public health officers locally and statewide and nationally. It's been a big ask, and everybody's responded extremely well under challenging circumstances, that's for sure.
Mm-hmm.
So thank you.
Thank you.
Okay, Bob, just wanted to give an update as we're heading into November. We have a couple upcoming board meetings I'd like to note. One is on Tuesday, November 2nd at 6 p.m. There'll be a public hearing on the 2022 proposed budget. It's at 6 p.m. at the county boardroom, 4th floor. Also at that same evening, there'll be a separate public hearing regarding the Dodge County redistricting plan. And as we mentioned before, that comes up every 10 years with the new census data, and it's anticipated that the final plan will be presented to the Dodge County Board on Tuesday, November 9th. And also on November 9th is the actual regular county board meeting for the month of November. It's always a little bit earlier in November. It's typically that second week, and that meeting on November 9th is at 9 a.m. And again, that's in the admin building on the 4th floor in the county boardroom. Part of that agenda on November 9th will be the consideration of the proposed 2022 budget. Just some highlights on the budget. There's always seems to be the concentration on the tax rate, on the mill rate, and the county portion of the property tax bill, the actual mill rate, is scheduled now to decrease approximately 35 cents. And that's good news, and that's just a factor that the equalized valuation in the county has increased, and so that's what lowers the actual mill rate. And I believe everyone is aware that the county portion is just one component of an individual's tax bill, along with the local entity, whether it's village, city, or town, your local school district, the state of Wisconsin, and technical schools or colleges. So Dodge County is just one component of that. Some highlights of the budget: we're looking at making investments in human services. There's an increasing demand for mental health services, and looking at allocating some additional tax levy dollars to human services. Also looking at another round of investment in the county highway system. Last year, the county board, through a survey, looked at the possibility of spending $18 million over a 2-year period through 2 separate borrowings for highway projects. And so the first round, the first $9 million, was allocated in 2021. Those projects are just wrapping up. and then heading into 2022, the budget is built with another $9 million borrowing, and that'll be up to the county board uh, through some separate action after the budget. And I certainly do expect on November 9th there's going to be some county board discussion regarding the proposal to borrow another $9 million. But that's great to have that debate, and if this would move forward, there'd be the opportunity for about 28 to 29 miles of the county system to be upgraded in the 22 construction season. We're also looking at investments in information technology, both from a storage standpoint and with some cybersecurity upgrades as well, and also investing in our parks, as we've mentioned before, making some improvements at Durgee Park, at Ledge Park, and at Astico. So that's all on the table, so we're looking forward to that. Also looking at some maintenance projects. One of the major ones are right here in Juneau with the courthouse and the jail, looking at having the roofs replaced at those facilities. As you're aware, that those buildings were constructed in 1999, opened in 2000 in that area, and so now we're 20 plus years in, and the plan is to have those roofs replaced during the 2022 summer season. Also looking at upgrading the 2 public elevators at the Henry Dodge office building, which is very important for the public and to have the access, because it is a multiple story building, and looking at having those elevators upgraded also in 2022. So through the budget process, we're trying to invest in quite a few different areas and trying to move the county forward. Also, there's also investing in our workforce. There's a cost of living increase that's built into the 22 budget as of January 1. It's 1.25%. You know, as it turns out, the cost of living, the way just things are nationally, is certainly higher than that. But we're trying to move to advance our compensation plan as much as possible to keep pace with what the market is. And again, through the budget process, we've had outstanding cooperation from all department heads, everybody, you know, pulling together, working together, trying to do what's best in the long run for the county and the residents and the programs and services that are provided.
Can you talk about the highway projects that were conducted this year? Are they done with? Are they wrapping up now? What's going on?
Well, one of the most visible ones in the Juneau area, the Highway M project between Juneau and Watertown, the second phase of that project is open, and if you have an opportunity to travel Highway M between Juneau and Watertown, there's approximately about a 3-mile section that's scheduled to be reconstructed in 2022. And as you're traveling, the upper portion from 60 north has been completed. If you go to Kleinman, it's completed, and then south of Kleinman is this 3-mile section. And when you travel that whole length, you can really tell the difference. This 3-mile section scheduled for 22 is in definite need of upgrade. But other than that, it's been a great project. The first 2 phases, Highway BB is open. A very nice project. It's about 11-mile stretch of Highway BB from 60 down to Highway 19. Turned out very well. There's a project, County CP is not quite open yet, but it should be open within the next 2 weeks or so. And on Highway 60, that State Bridge project, it's my understanding that that's scheduled to be completed around the 15th of November, but that will be somewhat weather dependent as well. And the bridge projects on County S They opened a couple weeks ago, mid-October, and very nice improvement there for the traveling public as well. So for 2022, again, this Highway M project, and also looking at other projects in all four quadrants of the county, trying to improve the system on a county-wide basis and not concentrated just in one single area. So we'll see what happens on November 9th and see what direction the county board wishes to take for 2022.
Okay, do you have anything else?
No, we just want to thank everyone, as now we're heading into the month of November. It's hard to believe, and hope everybody stays safe. And we know there's a lot of hunting activity, and so we have that, and hopefully it's a great opportunity for everyone to get together with family and friends later in the month as well. So we look forward to that also.
Thank you.
Thank you very much, Bob.